Dr. Jaffe, when serum vitamin C levels are low, do the organs that concentrate vitamin C release their storage back into the serum?
What an interesting question. Yes, when you measure ascorbate, you actually measure it in plasma rather than in serum. But if we measure ascorbate in the fluid, the plasma, and we know that the metabolically active cells concentrate ascorbate 30-fold over the blood. So let's say you have 1 unit in the blood, in the adrenals, in the thyroid, in the pituitary, in the brain, in the gut nervous system, you'll have 30. Now, your question is an interesting one. If the intake of ascorbate is impaired, if people are at risk of chronic scurvy, which means low intake of vitamin C, do the cells that concentrate it release it back into the bloodstream for the rest of the body to use? And the answer is not really, because at that point, these metabolically active cells say, I need the ascorbate. In fact, in healthy cells, ascorbate is either the number 1 molecule in the cell or the number 2, and it's close between magnesium and ascorbate. So ascorbate comes in, magnesium comes in, they stay in the cell. They do not get released when the person is low in their intake of ascorbate. So ascorbate is water soluble, and you always want the buffered, reduced, all L form, the fully buffered, fully reduced 100% L ascorbate, which is easily taken up 100%. So we do recommend supplementation because diet alone, given the toxins that we marinate in the 21st century, diet alone cannot provide enough vitamin C to keep you healthy for life. Supplementation of the natural form of ascorbate is urged and recommended based on the C cleanse or however you as a professional would guide it. And thanks for asking the question about whether the cells would be generous enough, would be cooperative enough to release their concentrated ascorbate when the rest of the body needs it. And to the best of my knowledge, the studies that have been done show that that does not happen.